I would like to read something that was written by a sister of a donor hero of ours. And this states, the gift you give will bless a teenager, an adult, a senior. You will give them the gift to dance in the rain, to let the sun wash over their face, to love life like they never have before. The gift you give will grant them the second chance that you had to kiss their child's cheek, to hold their hand, to hug their mama tight, and to console their dad. The love you give will grow flowers in their gardens, paint their homes with color. When the sun disappears into a great orange light, they will remember you and the gift you gave. When the flocks of birds fly above, your family will look to the sky and imagine that you are among them. Perhaps you will grow wings to dance with the stars. We will all forever see you as the gift that you are. Thank you, Nicole, for your absolute selflessness, getting nothing in return. We put our heads together to sing you this song. Our hands will hold on to your decorated arms as you go into the light and unfold your wings. We cry and we cry, but think of all the souls you will save. And it's all because of the gift you gave. Rest in peace, Nicole Marie.
Hey there, fellow rebels. Welcome to #ActuallyICan, the podcast where we say a hearty hell yes to designing life on our own terms. I'm Katy Ripp, a lifestyle coach, business mentor, and serial entrepreneur, here to guide you through the wild ride of defying what society expects of us and embracing our authenticity. On this show, we dive deep into taboo topics like death, money, spirituality, entrepreneurship, unapologetic self-care, and personal development, all while swearing and laughing along the way. Expect down and dirty conversations, plenty of humor, and a whole lot of exploration, leaving you feeling empowered to be your truest self. Whether you're craving a good laugh, seeking unconventional self-care tips, or simply looking for some camaraderie, you've come to the right place. We only get this one short life, so buckle up and let's design yours on our own terms. Ready to dive in? Let's go! Thank you guys so much for doing this for me. The intention of it is to talk about quote unquote taboo topics. My intention was like death and money because nobody likes to talk about it. I'm guessing the three of you know that very well. So I lost my father-in-law when he was really young. He was only 59. He had an open heart surgery, came out of it with flying colors. They pulled the breathing tube, dislodged a clot, and he was gone. Now, not gone right away. We waited, they tried to save him for 2 or 3 days, but obviously he passed away. Extremely Catholic family. I don't know if they donated his organs, but I'm guessing they didn't. And Abby and I talked. My intention for this podcast is not to persuade anyone to do it. It's more of just like information. Let's talk about it. Let's dispel some myths around this. I think I know everything, by the way. And I do not. And I'm very, I know I don't know everything. However, I think I do sometimes. And then I read some of these myths that Abby sent over to me. And I'm like, oh my God, like people believe these things. And I didn't know some of them. So I'm really, really looking forward to having a conversation, just really in a way of what brought you to the jobs that you have, which I feel like there are jobs and then there are callings that we happen to get paid for. And I don't think that people that work in the death industry, I don't know if it's called a politically correct name. I had Alana from Good Morning on not too long ago, and we were talking about death cafes and funerals and funeral homes that are no longer called funeral homes and, that kind of thing, that it's hard to talk about this because you don't know what's right and what's wrong. And you don't want to offend any certain population, but the reality is we are all born and we are all going to die. There is like no way around that. So first and foremost, thank you so much. For our listeners, there are 3 of my friends sitting here. I'm going to let them introduce themselves, but they all work and give back, I guess I would say, in the organ donation field. So, Abby, would you like to start a little bit of intro? What I'm really looking for is name, how long you've been in the field, what attracted you to the field. Did you end up there? Did you want to go there? And just tell me a little bit about your story about how you guys all got there. It's sort of fascinating that you're all local and all work in this and all have a passion for it. So really, I'd love to know any like bits and pieces of that.
Sure. I got into nursing. I never wanted to be a nurse. I never thought I wanted to be a nurse and ended up being a nurse, and I've loved it. I've been a nurse for 18 years. And I had an aunt who she got very sick and she needed a liver and a kidney transplant to survive. And I was probably in high school at the time. So they only gave her about 24 hours to live. And she was able to get listed and she ended up getting transplanted and had, I think, about 5 more years with us because of that gift that somebody gave to her. We knew that it was from a young man who had passed away in a car accident, I think somewhere in the Midwest. And just seeing how my whole family kind of gathered around that tragedy, that he experienced, and then that gift, and just working through that whole experience with my family was really moving to the point where I always kind of had a special place in my heart for transplant and donation. And then I started nursing school. I had clinicals and did a rotation at UW on the transplant unit in clinical. And I enjoyed that. I just didn't think I was quite ready to start there as a new grad. So then I've been in this role for 5 years after doing some ICU nursing, which I think pretty much all have backgrounds in intensive care nursing, and have been in this role for 5 years. And it's a really special group of people, and people in our department are so connected to the mission. I think it just makes it such a incredible and special place to work because it's so mission driven.
Amazing. And you said you've been in this role. What is your role?
So our titles, what we do is called organ procurement coordinator. So we basically start kind of right from the beginning, following cases that may not have a good outcome for the patient or for the family. And then we kind of follow them all the way through to the time of the operating room where they have the procurement, what we call it now, surgery done. And then that's kind of where we stop in our role and kind of transition the family care to other people in our department too, but organ procurement coordinator.
And are there multiple of you? Is like all 3 of you do the same job?
Yep. I think we have less than 20 people that do this for this entire part of the state of Wisconsin. So it's not a very common thing that nurses can get into. I think a lot of people, including myself, didn't even know that this existed until there was an opening and an opportunity. So it's just kind of steered us in this direction to where we are today.
Amazing. Thank you. Kayla, you're up next. If you would give me your story and how you got here.
Yes, I've been a nurse for, it's 2024. I've been a nurse for 14 years. I have worked as an organ procurement coordinator for the last 8 years. And prior to that, I worked in ICU nursing. And I don't, a lot of people that work in our organization, they do have some sort of personal connection to whether it's organ donation itself. They knew somebody in their family who was a donor, or transplantation. And I don't really have that. But what has drawn me to this is the donor families and just how strong they are. And if you think about all the surgeries that take place in the United States on patients, the organ donation recovery surgery is the only surgery that will take place that does not have a direct benefit to that patient. Every other surgery that takes place, there is a reason for it to happen, and it is supposed to be a direct benefit to that patient. And the recovery surgery does not. It's the only altruistic surgery where that procurement, the recovery of the gifts, is truly to help save other people's lives. And the fact that people say yes to this, that families follow us on this journey, that's what powers me to keep going. That's what has attracted me to this job in the first place. It's just, if I can have just a tiny bit of the strength and the courage that they have, then I can go to work every day and bring my best self and try and save as many lives as possible.
Are there doctors on your teams?
So we have medical directors. So we have 3 physicians who are medical directors for our organizations. They have backgrounds in transplant or in critical care medicine. But as far as the coordinators ourselves, who really kind of are our front line for organ donation for our organization, we're all nurses.
Okay. Can you walk me through procurement And this can be high level, right? Like, what are the steps, high level steps? I don't need anything, details.
Do I know about like the surgery itself, or just like how does like donation happen in a nutshell kind of
Yeah,
thing?
just a nutshell. Like,
Okay.
From an accident, because I would imagine like a lot of them are accidents or traumatic.
Yeah. The hospitals that we work with, we have set criteria for them to give us a call when they have a patient, whether it's in the emergency department or the ICU who's really sick. And most of the time when we get phone calls about these patients, they end up actually not going on to be organ donors. So only about 10% of the patients that we hear about a year go on to organ donation. Last year, we had 199 organ donors. So most of the people that we hear about, they actually, a lot of times they get better. They get the treatment that they need in the hospital. They have life-saving surgeries. They end up getting better to the point where it looks looking more like they're going to live as opposed to that they're going to pass away. Some people, they maybe aren't going to survive their hospitalization, but they might have histories or they might be too sick to be considered for organ donation. And then the ones that we think could be organ donors, we work with a staff of family support specialists that will go to the hospital when it's the right time to meet with families, to talk to them either about the organ donation opportunity or to tell them that their loved one has made this decision and what the next day or couple of days are going to look like. We do diagnostic testing on all of our donors to see if their organs are healthy enough for transplant. And once we have all the testing done, that's when we start trying to find the good matches, the good recipients for their gifts. And we currently utilize UNOS. That's a name that a lot of people are familiar with, is UNOS, and they are in charge of our matching system, if you will. And we talk to transplant centers. And once we have identified the recipients who seem to be the best matches for those gifts, we will coordinate a time for that donor hero to go to the OR for the recovery surgery. For kind of like the bigger gifts, if you're thinking like heart, lungs, liver, a lot of times those teams, those transplant centers will come themselves to be a part of the operation. And they will go to wherever the donor is going to be having the surgery. So if we are planning to do the surgery in a small town called Wausau, Wisconsin, we can have people flying in from all over this country to be there for that surgery. And then the surgery, all the gifts are moved at the same time. The surgery takes place, just once the teams come in, the gifts are recovered, and then they will go back to their transplant centers and they'll be transplanted into recipients.
Did you call them a donation hero?
Yeah, that's because what they are.
Oh my God. I'm going to cry at least 3 times already. One of the questions I have, and maybe Louise, you could answer this for me. How fast is this process? Like, I think about this and I'm like, oh my, is this like within like hours, all of this is getting done? Like, is this like a dopamine hit every day? Like an adrenaline rush?
Sometimes. There's a couple of us here who really like those kind of recoveries.
Yeah.
Me and Kayla, to be specific. Typically, our process is like a 2 to 3 day process. We can do it faster if we have to in those situations where patients are particularly unstable or in the situation of time constraints with families. Sometimes they've got funerals planned already within a few days and we just kind of have to meet them where they're at with that. Sometimes if they're eligible for maybe just liver or kidneys, those recoveries can go faster too. There's just fewer diagnostic steps we have to take in order to make sure that those organs are suitable for transplant. But our general timeline is 2 to 3 days.
Okay. Still fast, especially in the world of medical. Okay, Louise, tell me how you got here.
Sure. I have been a nurse for about 10 years. I started out in oncology and hospice over to being in the neonatal ICU. And in 2022, made the transition to this role, just kind of a roundabout way. I had a friend who was also in the role at the time, and she thought it would be a good fit for me. And I was really kind of ready for a change at that point in time. And I think the thing that I've noticed about all the different areas that I've worked is that it's a very special population, very small percentage of the population. NICU births are like 1% of all births go to the NICU. Like 3% of all deaths become organ donors. Like it's just very, very specialized. And I think that's something that, you really don't understand how special those roles are until you're in them. And I really like that.
A couple of stats you guys have thrown out. One was 3% of deaths are donors. That seems extremely small.
Eligible.
Yep. So that seems like an extremely small amount of people. So those are the eligible ones out of a very small number of people who are actually donating, I'm guessing, right? So we'll get into some of those numbers. Also, Kayla, you had said 199 a year. Is that how many in this area have been successfully donated? Is that the number we're talking about?
Our organization, we have a designated area of hospitals that we work, and it's quite a large area. It's a good part of Wisconsin. And then last year we had 199, and that was a record breaking year for us.
Wow. Okay. I mean, I'm guessing that's a win?
It is. That means, that we had more transplants, donors in our organization.
More people were donating. Yeah. It was more like people donating, giving gifts, more heroes, right? All of that.
Yeah, I think some people, when they say, I think that people might be a little jaded by that number, like that we shouldn't be celebrating it, but these people are going to pass away anyways. Like we are not causing the bad things to happen, but we are allowing for some good to happen in these really, really dark times. But yes, that was a big deal for us. And it was a big deal for all the recipients who received life-saving gifts last year.
Well, right. If we're looking at it from that point of view, which I don't want to be insensitive about this for the people that are losing people, because that is extremely difficult. And I'm guessing a really difficult decision to make when you have to make it. It's one of those decisions, like if you have to make it and it's not already made, you have to make it in a moment that doesn't feel right to make that decision. So I don't want to be insensitive to that. But on the other side of this, what a gift. You are giving, I have goosebumps. You are giving somebody a new lease on life, even though yours is over, right? Like that one is over. It's been over for a little while now, right? And what a gift. And I'm guessing that the recipients feel very different about that quote unquote win than the other side. So there is two sides to this. And I know a really good customer of ours lost his daughter, and they were able to procure. I'm guessing the harvest word is no longer right. So they were able to procure her heart, pretty much everything. And I am going to ask you guys what everything is, because I think there's lots of myths around that too, but they were able to procure everything. And he got to hear her heart in somebody else's body. And the video it was fascinating. And it was such if you ask him about it, it was such a gift to him, right? Like to know that this person went on and lived a life with her gift, because he was going to lose her anyway. So I'm sure you hear stories like that all the time. I really want to get into these like top 10, 11, 12, 40 donation myths that are out there. Again, I want to make sure that anybody who's listening knows that this interview is in no way a way to persuade somebody to do this, to make them change a decision. This is really just an informational way to tell people, if they're interested in it, how can they do it? And also some of these things that have been floating around out there that are true or not true from the actual experts, and not just what you hear on TV or what you see on ER or, whatever it is. I don't know. Is ER even on still? So anything else you guys want to add before? There's also some things in here. Abby, thank you for this list. I love this list so much. I also would love to talk about, and if you guys don't want to talk about this, that's totally fine. But of course, you see these like walks, you see them on Instagram, like they take my breath away every time I see one. I want to know if that's real. And I want to know if that is something that happens. Like does somebody choose that to happen? Would you like this to happen? Is that something that just gets done? I just think like we all have been exposed to that now because we live in this video and image world. And it seems really heavy to me to be like putting that out there. But at the same time, like they should be honored. So I want to know if that's real.
It's real. It's real. Yeah.
Tell me the process about that if you want to.
Sure. We work with the hospitals very closely. The hospitals are actually the ones who kind of facilitate that honor walk. And it is a question to the family. Like, is that something you want? Is that something the donor would want? and kind of explore that part first. Most often, I would say almost all of the time, families want that for their person. Sometimes the families aren't even at the hospital, we'll still do them because, like you said, they deserve to be honored in that way. And some of our best honor walks sometimes happen in the middle of the night or on the weekends when you would think there is nobody around and nobody available to come and stand and pay their respects. But we've heard from our hospital partners that sometimes those are the biggest, best honor walks that they've seen. Sometimes families choose music they want to play during the honor walk. Sometimes they get extra moments to say goodbye at the elevator doors. It's every bit as moving as you can imagine watching those videos and then some.
How does it get paged out? I feel like I'm asking really stupid questions, but I feel like people want to know. Like, I'm so curious and fascinated by that. And we've heard of, when somebody loses a baby, let's say, like they put something on the door that's like everybody knows and that kind of thing. Is that is it a call over the PA? Is there a code for it? How do you get people there?
I think every hospital does it different. The one hospital I work with quite closely, they will send a page out, not overhead, but to all the charge nurses' phones with the time. And we usually know the time that the honor walk is going to take place well in advance. That way, then nurses will start coming down like 10 to 15 minutes beforehand. It's not just nurses either. I mean, it's physicians, and anyone who works in the hospital. We have our, environmental services staff. They all will come down, line in the hallways. We also let the families know the time, and then they will also, a lot of times our families invite their own community in, right? Their community, their church community, their friend community, their child's school community, their own family members, and then they will also all line the hallways as well prior to the patient going to the OR. So I think most hospitals use a paging system.
What also a gift of closure, right? I mean, not only the funeral, right? Like you get that part too, but it's an honor walk, right? Like they're a hero for that. Oh, so fascinating and amazing.
And we talk to families about it too. I have the privilege of talking with them like immediately afterwards, and they are always just so humbled that somebody at that hospital took 5 minutes out of their very busy day to pay respect to their loved ones. And it means so much to them when the doors to the ICU open and they can just see a hallway fully lined with people paying their respects. It truly means a lot to them. And there's so many times I hear families say, man, my loved one would have loved that. They would have thought that was just the coolest thing. What a beautiful send out.
So I was going to ask this at the end, but this seems like an appropriate time to ask it. When you work in a job like this, right? Like, and again, I think that there are jobs we get paid for and callings we just happen to get paid for. How are you guys taking care of yourselves?
Abby and I have
laughing on mute, which I don't love.
I think one thing is that we all could be better. I think that goes for anyone in healthcare these days, really. I think that healthcare in general, when you're working on the front lines, it's tough. It's a tough environment out there. There's just a lot of division, I think, in our country in general. I think that just causes things to be harder. But Abby and I have been dealing with this lately by running. We're not runners, but yes, we try.
If you run, you're a runner.
And we like to spend a lot of money doing races in Disney World. That's our outlet. That's how we're getting through this.
It's a $1,500 t-shirt. Nobody is saying anything.
I think a lot of it too is we work in an office closely with others on our team. And very frequently we kind of go through those tough moments together and kind of process and digest them as we go, if we can. Sometimes the moments are too busy and full of logistical things to worry about the emotional side, but every now and then there's a moment that catches you or a comment made by a donor family. I think what catches me the most is just the utter generosity and thoughtfulness that these families who are going through the worst moments of their lives will just express to you in simple conversation over the phone, whether it's like, well, I don't want anybody to fly if it's bad weather, or so you can do the OR 6 hours earlier than we thought, or, things like that. And I'm getting goosebumps now too, but those were just like completely takes your breath away, the generosity and the thoughtfulness that they are able to display. It really just like grounds you and makes you very thankful for everything that you have and can do for yourself.
And I think another thing is like we work so close together. I don't think any of us have ever would ever say that we don't get sad. We haven't cried at work. There are tears all the time at work, and it's like accepted, it's encouraged, just checking in with each other and just making sure that it's okay to feel those things. That's human and that's normal. And
I would be really worried if they weren't.
Right.
Right?
Yeah.
Like if people were not having emotion about it, it would be worrisome.
Yeah. But we've all cried on the phone with donor families that we're talking to. And I think it lets them realize how heartfelt we all find that process to be too.
Yeah. Okay. I also would love to know what this system is doing for you guys to help you take care of yourselves.
It's exceptionally hard for us, like right now at this moment, when you ask that question, I think we would all start crying just because, nursing in general doesn't have staff. We don't have staff. It's a really hard job. You have to find the right person to do this. Like you said, this is not just a job where you take home a paycheck. Your heart and soul goes into this and you give a lot every day. So we're relating to our community, like us together. I mean, if you think about every single patient we take care of is going to pass away. Every single patient we take care of passes away. So it's hard and it's heavy. And, I think right now it's maybe even a little bit harder. But again, since we have such a great group of people doing this, it's so easy to build each other up, right? Mm-hmm. It's if you are having an especially hard day taking care of a patient because it's the most tragic story you've ever heard. And just when you think you've heard the worst, something else happens next week. And encouraging your coworkers to go take a walk, right? Or it's somebody from our staff knowing that we're so busy bringing bagels and coffee, tell me your Starbucks order. Let me go pick that up for you. It's those small little things that make a really big difference when we're doing this really hard work.
Just systematically, we have a peer support group that has just started this year also as a result of some feedback we've had in the past. And so I think just starting to use that in our regular basis as a space to tell your story, maybe unload some things, but then also to receive that validation and rebuilding yourself and your team too has been really cool to see it kind of develop. Yeah. We had some folks from a local emergency room come in and kind of train us how to do that. And so that's been a very well-developed and thought out sort of resource that we have. And we do those monthly, I think now, a couple times a month to accommodate for different schedules. But that's been really helpful too.
That is amazing. Although it doesn't really still seem like enough. And also, right, you're in a job. We're all in jobs, but we all have fucking kids and animals and shit that happens on the way to work. And right, everybody has bad days. You happen to have bad days on top of all of your patients dying, right? There needs to be a special place for you guys, I think. I have lots of ideas there, but we'll keep that for a different day. Okay, I would love to go over some of these top myths about donation and what organ donation is, what it is not, how we can do it, how you don't have to do it, who's helping, who's not, how, all of these. So I was thinking, Abby, you sent me these amazing myths that, again, I was shocked by. And I thought I would just read off a myth and you guys can dispel it.
One thing we do to do, if you don't mind, before we start, I would like to read something to share with everyone. So this is something that we like to do in our office before we have a meeting just about anything. We call it a connect to purpose. And it really does kind of remind us of why we do the work that we do. And so what I wanted to share is a moment of silence, what we call it. And anytime we have a donor hero that's going to the OR, we ask families if they would like to write anything down about their loved one that we can say before the surgery even starts. So all the surgeons are in the room. We kind of pause the beeping and everyone kind of folds their hands, bows their heads, and we read whatever the families have prepared for us to read about their loved one so that we can honor the donor hero before the surgery starts. So I would like to read something that was written by a sister of a donor hero of ours. And this donor hero went to the OR in July of this year. And this states, "The gift you give will bless a teenager, an adult, a senior. You will give them the gift to dance in the rain, to let the sun wash over their face, to love life like they never have before. The gift you give will grant them the second chance that you had to kiss their child's cheek, to hold their hand, to hug their mama tight, and to console their dad. The love you give will grow flowers in their gardens, paint their homes with color. When the sun disappears into a great orange light, they will remember you and the gift you gave. When the flocks of birds fly above, your family will look to the sky and imagine that you are among them. Perhaps you will grow wings to dance with the stars. We will all forever see you as the gift that you are. Thank you, Nicole, for your absolute selflessness, getting nothing in return. We put our heads together to sing you this song. Our hands will hold on to your decorated arms as you go into the light and unfold your wings. We cry and we cry, but think of all the souls you will save. And it's all because of the gift you gave. Rest in peace, Nicole Marie.
You read that every time?
So we read something like this. Sometimes it's too hard for families to kind of put into words their kind of last goodbyes to their loved ones. And in those cases, what we'll do is we'll actually just all do a true moment of silence, where everyone will just bow their heads and not talk for, a few seconds before they start the surgery. But most of the time, people write something down like this.
Is this the poem that you read before your staff meetings every time?
We read a different one every time. So we choose, sometimes we will read letters that donor heroes have written to their recipients. Sometimes we read letters that recipients have written to their donor heroes. And sometimes we read a moment of silence. And we reached out to this donor family last week to ask if it would be okay if we read this particular one. And they were so thrilled to know that we were going to honor their loved one again in this way.
It's a beautiful tribute. A moment of silence there. Really unbelievable. Thank you for that. That's another gift. This is another gift of that donor, is to educate people. Now, I have tens of followers, right? Going out to millions of people yet. But, if you can change one life in this way, when somebody is a donor hero, they could possibly save many lives, right? And that is actually one thing I would love to ask, what does that mean when somebody donates everything? But if we educate one person here, if one other person is willing to talk about it, I feel like our jobs are done. So how about if somebody, that is a question of mine. What can be donated?
I was just going to say too, I don't know if you want to add to the previous part, but I know something that donor families always mention as very touching is hearing their loved one's name again, said out loud, because their story doesn't end with that moment and it continues on. And I know that we've heard that many times from donor families, how they want this story to keep going with their name and saying it out loud. So just wanted to throw that in there too.
As soon as you said Nicole, that's what got me. Right. Because it makes it very personal. It's like Nicole had a name. Nicole had a life. Nicole had a sister, obviously, parent, Nicole was a human being. And is that something that is said often? Did that change at all in the last, has it been more humanized? Do you call the patients by their names in the procurement and or the recipient? Is that
I think in healthcare,
Nicole's heart.
Yeah, I think in healthcare in general, we've tried to get away from calling them by a bed number or a diagnosis and really recognizing that this is a person with a story and a history and a family and all those things. And, that's their gift that they're giving to somebody else. So I don't know when that movement really started, but I think we do a pretty good job in our organization of doing that and recognizing the individual part of that.
You never really know about, who wants to share what, but as soon as you said her name, I that's what got me. So I appreciate that they would be willing to do that, because I would imagine that there's some story around that for some people, but I love that they included her name and wanted it said again. And that's pretty common. I would want my name to go on, right? I don't want to be a number, especially in that situation. So thank you for adding that, because, there's something so powerful about a name anyway. Even in the most trivial ways, right? We say, thank you, Abby, at the coffee shop. And it's important to people. So, in death, it should also be important to people. Okay, anything else you guys want to add before I get into the myths? I don't want to cut anybody off or not. I mean, it doesn't have to be the last thing we talk about either, but I want to make sure whatever we're doing, I want you to make sure that we're not missing anything.
Yeah, we can go into the myths. And, you wanted to talk about like a full donor.
Oh, yeah.
So for organs, and that's primarily what the three of us, the part that we work in the organization does the organs for donation. So we are looking at lungs, and each of those could actually be split in recipients. So that can go to two separate people.
Oh, fascinating. I didn't think about that. Like
Yep.
we have two of every, we have two of everything kind of.
A few of them. Yep. They can work, independently, and sometimes people only need one. So,
okay.
Then we'll find another single match for the other lung. Look at the heart and the liver, which can also be split. We see this, I think, most frequently with pediatric patients, or they only need a small section, and the liver can be split and put into multiple recipients. Kidneys are two separate as well. And then we also do pancreas and intestines for the organ donation. And then for tissue, they have a pretty extensive list of what they would use for tissue. And I don't want to speak too much because we work with them, but that's not what we're doing. But they will use heart valves for valve replacements for people. They will use like heart tissue. They will use bones, connective tissue. They'll do skins, like for skin graft. They will use corneas.
Why do you know about bones?
Yeah, they take bones and sometimes they'll use like parts of it. And I remember learning about how they'll actually use a bone to make like a screw that's made of bone that they can then use to like screw into somebody else that needs bones to be connected. So they're not just taking like a full bone.
Yeah. It's not like you get a new femur or anything, but like bone pieces. Like I just had Achilles surgery and they used like an actual screw that dissolves, but possibly they could have used a screw that was somebody else's bone.
Yep. And they do like small fragments and almost make like a concrete kind of mixture. They can do that by breaking some of the things down to pretty small amounts. And then for eye donation, they will take corneas that they can use for eye transplant with the corneas. So there's a lot of things, and not everybody can do all of those, but I think, what did they say? 75, like a full donor. If every single thing could be given to a different recipient, could be up to 75 different lives from one donor hero.
Oh my God. And not all saving lives, but improving the quality of life.
Yes, for sure. Yep.
Yeah. Fascinating. I mean, we could go on and on and on about this. Do you guys learn about how it's done, or is that not really it doesn't need to be in your wheelhouse? Because I would want to know all of it.
Like the tissue part,
donation? Just all of it. Like, I want to know how it's done, right? Like, I mean, like the transplant part of it, like the procurement to the recipient and what happens in between. Like, is that something that you guys need to know, or is that like a different department?
No, we do that as part of our orientation. We will go into the operating rooms and watch, the full procurement surgery, because we can't really be helpful, or it's a lot easier to know what other people may be doing if we have to reach out to them so that we know what they're doing in their role, kind of like they follow us and find out what we're doing. So yes, that is somebody else on a different part, but we're still the same team. And I feel like we all kind of have a good idea of what goes on because we've seen a few.
Well, and it makes you do your job better when you know at least something about it. Are there surgeons that this is all they do?
Yep.
So is it a procurement surgeon?
Yep.
Is that like a specialty?
Yep. So I don't know exactly the pathway that they take, but they usually do their full,
residency,
medical school, the
everything.
residency. Yep. And then they decide that that's the pathway that they want to do. Mm-hmm.
A small portion of surgeons, I'm guessing.
Yes, it's very specialized.
Yeah.
And a lot of times the transplant centers that we work with will actually have their own transplanting surgeons do recoveries as well. There are a very small handful of surgeons in this country who just do recoveries. They work for organizations that kind of do contracts for doing recovery surgeries. Otherwise, a lot of times a transplant center will have If you have two heart surgeons, one will be on for the transplanting of the gift and the other one will be on for the recovery of the gift. And we also do have staff who aren't surgeons who are trained and certified to do recoveries. So on our, as part of our organization, we have like a PA, a surgical PA by training, who is trained and certified to recover abdominal organs for transplant. So it doesn't necessarily have to be a surgeon, a transplant surgeon.
Okay. Who pays for it? Oh, wait, that's one of the myths.
No, that's okay.
Sorry. I'm like, who's paying for this? Is this a nonprofit or okay? Are we ready for the myths? Top 11 organ donation myths. And I am going to read the myth and one of you is going to dispel it for us, right? Doctors won't work as hard to save the lives of organ donors. This one sort of caught me off guard. It's the first one. And I was like, who the fuck thinks this? Like, who is really out there thinking this? Tell me.
It's actually very common in minority populations that carry this belief. Personally speaking, my boyfriend is African American. He came to me. We met. He had this belief. And I was just as blown away as you're saying you are too. That was the first time I was really exposed to somebody who actually felt that way. The primary goal is always to save the life of the patient who is coming into the hospital. Organ donation does not come into the picture until end-of-life decisions are being made, once all the efforts possible to save a patient have been exhausted. Often, when we first become aware of a patient, doctors and nurses, anyone, chaplains, social work, people caring for them at the hospital have no idea what their donor registry status is.
Okay.
Unless a family has already mentioned donation and says, oh, look, I have their driver's license. They have a dot on it. Very rarely do they know about it before we do. We also work very closely with care teams to avoid conversations about organ donation occurring until the very right time, which is in conjunction with those end-of-life conversations. And we really want to make sure that families are understanding and accepting that their person won't survive before we have any discussion about donation potential. We have to keep those conversations completely separate because often, particularly in the cases where we're asking families for permission for donation, if you ask them too closely to the conversation they just had with a physician or the care team about their person is not going to survive, and then we just like swoop right in and mention organ donation, they can't even comprehend that.
Yeah.
And any reaction they're going to have to those conversations is emotionally out of fear, anything. And so we really have to give some time for them to kind of digest and come to a place where they're ready to ask, okay, what comes next? And then that's kind of our window where we can kind of come in and start having those conversations.
One of the things that comes up for me would be, what would be the reward for doctors not to save that person? You know what I mean? Like the myth is out that they wouldn't work as hard, but why? Like, what's the reward for the doctor not working as hard?
I mean, without getting too like down a rabbit hole, I think if you're looking at it from a minority's perspective, like there's a lot of distrust with the American healthcare system for minorities in general. Yeah. So donation into that is just another thing that kind of falls in line where, how do I know they're going to save my mom because she's Black or brown if they knew she was a donor? And they already carry a lot of those things with them anyways. And so I think that's where that kind of comes from. Yeah. Not that there's any reward, because obviously doctors and nurses and respiratory therapists and everybody caring for patients wants them to survive. And I think, if you have that baseline trust in the healthcare team, that's an easy answer for you. But when you lack that trust with your healthcare team, everything is in question.
Absolutely. Thank you so much, Louise, for your answer to that. Okay, number 2, taking organs from living people, not counting for living donation. Can somebody explain what living donation is to me?
So living donation is something that recently has been gaining a little more popularity, but this is where often it's a patient who has a family member or a friend that may need, it's often a kidney, sometimes it can be a part of a liver that they need. And if somebody in their family may try to, or start the process to get worked up to see if they can be a donor, and that would be something that we would call a directed living donor. And that's something that's done with the transplant center. They get all worked up, make sure they would be a good match. And then the surgery is planned, it's scheduled. They would, remove one of the kidneys or part of the liver and then do the transplant. at that time. And so that would be a living donor. That's not something that we would do anything with because it's with the transplant center side. So we don't really have a whole lot of experience with that because that's just kind of a separate thing. But it is getting more popular, I think, as people are having to wait a longer time on wait lists, and it's becoming a safer surgery. People are sharing their stories that they donated to somebody that they loved and they got a life-changing gift because of it. So yeah, we wanted to just make sure that we mentioned that too. It's not something we work with, but that's one option. That's
the Sally Field Julia Roberts of our time in Steel Magnolias, right? She donated kidney to her daughter.
There you go. Yep.
Oh, that totally ages me. Okay. This one, number 3, cost will be billed to the patient or their insurance. So as we were talking before, I asked, I was like, who's paying for the surgeon? And is the surgeon making that kind of money? And where's it coming from?
I can't say how much surgeons make for doing a recovery, but I can tell you that from the moment that we meet with the family of a donor hero, all costs going forward involved in that patient's care will come directly to our organization. So from any lab tests, any imaging tests, their nursing care, overnight stays, any hospital bills, those bills will come directly to our organization. And we also encourage our families that if they see something on a bill that seems like they should have gotten billed for, that they can reach out to us directly. And we have our billing department promptly review any sort of claims from families that they think that something should have been covered that wasn't, from the time that we meet with families till the time that their loved one goes down to surgery. Everything goes to our organization. In our organization, we get reimbursed by the insurance for the transplant recipients. So whether they're on Medicare or Medicaid, or if they have a private insurance, the reimbursement for that transplant surgery, that reimbursement goes to our organization. And we are a nonprofit.
Oh, okay. So does this nonprofit take donation?
Yes, we do take donations. In fact, a lot of times we get reached out to by donor families that they want to put something in the obituary or the memorial for them to be able to send any funds raised to the organization that we work for. It's called a Greatest Needs Fund. That way it's not just pigeonholed for a certain department or, for the recovery team. We can utilize it in many ways. We usually use it to, a lot of actually our fundraising goes to putting on a free conference every other year for the nurses and the medical staff in the state of Wisconsin. A lot of that is funded through donations.
Massages? Can we pitch something for massages for you people?
I think that would be great.
Yes, I also do. We need to talk about that. We'll definitely put that information in the show notes. Is that okay to do? Just
absolutely.
Want to donate? There's a place to do that. I'm assuming there's a place to do that online and people can make that decision on their own. Yeah, the cost is always I'm guessing it's a kind of a big myth. I'm already paying for X amount. And now I have to pay for this on top. I think it's very, it's good to clear that up. And if you think that, and it could be just one of those things that could be easily dispelled. Nope, you don't pay for it, right?
Yeah. And I think there's the other thing too about, and we didn't really talk about this regarding kind of costs, is that people might think that we get kickbacks or, a lot of money for the organ donation, transplantation world. And I can tell you that it just covers basically the operating costs. There really isn't, we're only reimbursed a certain amount, Medicare might say we will give you this amount to do a hip surgery, a hip replacement surgery. It's the same thing for organ donation and transplantation. It's a set reimbursement that we get from the insurance or from Medicare to provide those services.
Yeah. My face is surprised because also who thinks that? Right? That somebody's out there profiting from this, but whatever.
Hello, my friends. It's Katy here. If you're feeling stuck or searching for more purpose in your life, I have something special for you. My new book, Midlife on Purpose, is out now. It's all about embracing midlife as a time for growth, joy, and living authentically. Packed with worksheets, tools, reflections, and trackers, this workbook is your guide to rediscovering your passions and creating a life you love. Whether you're navigating career changes, personal challenges, or simply seeking more fulfillment, Midlife on Purpose will inspire you to live boldly and with intention. Get your copy today and start your journey to a more purposeful life. Available at katyripp.com and Amazon.
Okay, to kind of back it together, number 4 and 5. I am too old/young to be a donor, right? So like children, older people, right? And then I am too unhealthy to be a donor, which I think is probably pretty common that people think that.
Yeah, we put this one on here because I feel like we run into this a lot in conversations with our donor families as we're talking to them. That sometimes they're just absolutely shocked that one of these reasons would be something that for sure assumed that they would have been ruled out for donation. So they're surprised often. So as far as age, I think one of the first times that people are exposed to discussions about donation is often at driver's ed. So it's something that is required in the state of Wisconsin at driver's education training. There's a certain number of hours or minutes that they have to have the training done at those classes. And when they go to get their license, they're hoping that people would have had conversations with their families about, what their wishes would be in that situation. Of course, when you're 15, you don't really think about that necessarily. So it's something that they're exposed to in driver's ed. But we take referrals and we have donors that go all the way down to like neonates. Babies can donate. It has to do a lot more with size than with age. I think one of our rules is that they would have to be over about 2.5 kilograms to be a donor. So that's real small. Yeah, that's very small. But also there's not as much of a need for infant transplants. So it would be a pretty small pool of recipients that would need something that tiny. So we do go all the way down to that size for donors. And then we go all the way up. I think just this spring, there was a story in the news about a 98-year-old male who donated his liver. It's just wild to me. Like he kept himself on the registry and he was able to donate his liver at 98 years old. Each of the organs that we look at for transplant, they age at different rates. The highest range is usually lungs, liver, and kidneys that we would be looking at. Those we don't really have a limit for how high up, but we would do diagnostics to show us how well those organs may function in a recipient. Can't really be too old.
Yeah, but too unhealthy. Like lifestyle choices.
Yeah, that's something I think about a lot. If you're ever at like a gathering or a party and somebody asks you what you do and you say, I work in organ donation, and they got a cocktail in their hand and they're laughing, saying like, you wouldn't want my organs.
All the time.
All the time.
Immediately when you said it, I was like, well, you wouldn't want my, exactly what that person would have said.
Yeah, exactly.
Mine are much healthier now, but when I was drinking, nobody wanted mine.
And I will tell you the same thing that I tell these people. A couple of thoughts come to my mind when I hear these statements. And one, like Abby alluded to, we do pretty thorough diagnostic testing on each gift that we think can be transplanted to assure that it is indeed healthy enough to be transplanted. We also do serological testing on all of our donors for communicable diseases like HIV, Hep C, things like that. And even our donor heroes who maybe do have like hepatitis C or HIV, they're actually still able to be organ donors just due to the recent advances in healthcare. So hepatitis C is now considered treatable. So those organs can definitely be transplanted. And due to the HOPE Act a few years ago, we're now able to place HIV positive organs with HIV positive recipients. And we've had donors with 20-pack year smoking histories donate their lungs because we've done the testing to show that they're healthy enough. And we've had people who drink 6+ beers a day, daily drinkers, somebody who you would consider probably an alcoholic, donate their liver. Actually, and it's because we do the testing to prove that they are healthy and safe enough for transplant. And at the end of the day, it is the expert transplant surgeon who's evaluating those gifts who will make the decision about whether or not that's going to work for their recipient. So that's why I tell everyone, I say, especially if you're able to talk to me at a party with a drink in your hand, you don't look like somebody who's dying in a hospital bed waiting for a transplant. So I really do.
I think the lesson there is put yourself on the list. And let somebody that went to school and gets paid to make that decision decide. That is above pay grade. You let them decide. right? And you might like have the most gorgeous eyes, right? Like put yourself on the list. Oh, don't worry about it. They'll figure it out after you're gone.
Yes, exactly. And I think we even hear that from people who maybe are like cancer survivors, right? That think like, oh, I had cancer. So it's probably not safe for me to donate my organs, but certain cancers that are acceptable in somebody's history that they can still be an organ donor. And this list of criteria that we evaluate donors on changes all the time. Like Abby was talking about like age, like when I first started, we didn't do donors over the age of 80, and that number is significantly higher now. And we couldn't even consider somebody with a breast cancer history for donation. Now, certain types of breast cancer are okay. So we do, review everything with the doctors that work on our team to make sure that they do think it's safe to move forward. And we would never move forward with donation if it was going to be, a harm to the recipients.
Well, and ultimately, the person that is donating is gone. So they don't get to make that decision anyway.
Right. But we want to make sure that those people aren't making the decision to say no. So sometimes people can, you can document your donation decision to donate and to not donate, right? So we have actually talked with families before who have a loved one that has filled out a power of attorney for healthcare in which they have checked the box that says, no, I don't want to be a donor. And the only reason why they did that is because they didn't think that they were healthy enough to donate. And that's a legal decision. And we stand by that patient's legal decision. There's no reversing that. We want people to make decisions that are right for them based on right information. So if they don't want to donate, then we're going to honor that decision. We want to make sure it's for the right reasons.
Yeah. But like you said, it probably isn't because you're too unhealthy. And somebody else.
Probably not.
Yeah, probably not. Okay, number 6. There are enough organs for those who need them.
This is patently false. There are 103,000 people waiting on the national transplant list just in the United States. In 2023, 46,632 transplants were performed, which was a record year. The majority of those were kidney transplants at about 27,000, and about 5,600 people die waiting for an organ that doesn't come on the wait list each year.
In 1 year?
So each year, yeah. And if you think about the need and the availability of these organs, there's a huge discrepancy there. We have a lot of work to do to get people on the registry. Speaking more about the criteria that changes for donors all the time, a lot of times we're seeing that expand, and we're attempting on organs or donors who, we wouldn't have a year or 2, 5 years ago, just because, technologies have advanced. We have devices, pumps that different organs can go on after recovery to sustain their viability after recovery and prior to transplant. And using a lot of those new technologies allows us to expand the viability of those organs to get them to those recipients that are waiting.
I'm actually surprised by that myth too, that people believe that there's enough, because I feel like I've seen enough news out there that there's not enough. So I appreciate you coming on and saying that is false, because it's false. Number 7, many religions forbid organ donation.
Yep, that's not true either. Organ donation is supported by most major religions in the world, and they see it as a final act of generosity towards others. It's encouraged kind of as an individual decision in most religions, as a charitable act that saves or enhances life. So it's not really something that the religion feels like it needs to make a decision about, but just kind of leaves it to the individual, knowing that, they would support that as a charitable act, and they would, support the person for doing that. We work with a lot of people from many different religions and backgrounds. And I think the key that we see is to just have very open communication as to what is important with these families. We have found, a lot has to do maybe with timing, timelines, day or night, days of the week, how soon they can get to the surgery part of, the process. We've worked with families to get, religious people in to do blessings with the donor heroes, if that's something that the family really needs to happen before they can move forward. Sometimes it's something that they hold in their hand. A family puts something in their hand, or something that they should wear into the OR. And it's something that we want to be very open with these families and kind of explore what we could do to support them so they don't have any reservations about it. And I think just another thing is that we can't ever assume that somebody will say no based off of their religious affiliation. We see that a lot. A care team may call in and say, well, they're X, Y, or Z, so they're not going to be an organ donor. But when we sit down and talk with them, often if we can, do something or not do something and be a little flexible based off of what their wishes are, they are completely okay moving forward with organ donation.
Right. So on top of all of your other jobs and how heavy and intense it is, you have to ask very difficult questions and have like be brave enough and have the courage to ask the question.
Yeah, but I think it's always better to ask those hard questions rather than assuming something too.
Well, 100%, but it's still hard. And you still deserve
It's not easy.
You still deserve a massage for it.
Sometimes those questions feel easier than what the donor family is going through already. So it almost like gives them some control over the situation when maybe they didn't have control before, whether they need their person to always have the light on, or they need to hold an electronic candle in their hand, or there's all kinds of things that they want, or it needs to happen at this time of day, or, giving them back some of that control that they've completely lost in the situation is another way that the donor gives to their family too.
In addition, I think, having the conversation, I remember when Dale's dad died, we were all in the room and he was there and they turned off the machines and, we were standing there. But then it got to a point where we were standing there for so long with no direction that it was like somebody needed to tell us what to do. I mean, I'm guessing somebody from the care team came in and did say something to Dale's mom or whatever it was. I'm not sure exactly when that happened or how it happened, but to give somebody also some direction, like give me something concrete to make a decision about, because it felt very abstract after the actual event of the death. And it's nothing like you see on TV, by the way. I mean, you guys know that obviously, but like we didn't have a whole lot of direction afterwards. And we were kind of looking to somebody to like, what do we do now? Where does the body go? And maybe it was just my brain, but like, I was like, where does the body go? Do we follow? Right? Like some kind of concrete question to answer, basically. So it's probably, it could be very therapeutic for people. Like, give me some control. So that's a great point, Louise. Oh, well, this kind of goes in with the one before, number 8. I can't have an open casket funeral if I donate my organs. Also fascinating.
Yeah. So we work with funeral homes very closely in this process. And that's another thing that we discuss with families, what their funeral arrangements may be, because on top of everything that they're experiencing with the death of their loved one, they also are kind of moving forward with planning funeral arrangements and all this. And so we generally, I would say, know going into the OR what their wishes may be for like postmortem. But during the OR case, incisions that are made for the procurement surgery are closed and they do reconstruction. Surgical lines for the case are not in any areas where clothing would not cover them during an open viewing. And we've often see special requests to avoid tattoos per family. And that's something that is very personal to family members, and they don't want that to be cut into or altered in any way. So we can take those kind of requests. And then they have prosthetics for tissue and eye, if there's going to be a full viewing, that they can use in place of something that would have been removed to keep the shape. So as long as people, are wearing clothing for their funeral viewing, it's not something that would be shown.
Also fascinating. And things I would not think about. If you're getting your heart transplanted, obviously there's going to be a incision. However, you're probably not going to be bare chested in your casket.
Generally not.
Maybe somebody has.
Yeah. I'm sure somebody has.
Channing Tatum might, but other than that, I don't know who should or would. But I understand, like, maybe you're not in the right frame of mind to think that either, right? Like, oh, I'm going to have clothes on or whatever. So interesting. Number 9, organ donation interferes with death investigations. This is an interesting myth.
Yeah, one we hear about a lot, actually, on different cases, both from like hospital partners or sometimes medical examiners' offices themselves. We work very closely with coroners and medical examiners in the state of Wisconsin to ensure that both donation and any necessary investigation can occur in tandem. And we just have developed really good relationships through a lot of outreach and education that members of our team provide to those folks in the state of Wisconsin so that we can do what we need to do and they can have what they need to have. And, we rarely have any trouble with anything like that. Sometimes just the conversation about what can happen, what we can provide, what they need, anything like that. And just being very open with what is required for both of us to make things happen.
I would imagine there's quite a few myths around autopsy as well.
Yeah.
That being, very hand in hand kind of, no pun intended, I guess. Number 10, rich and famous people get preferential treatment when they need a transplant. And immediately when I read this, I'm like, black market organs. Seeing too much TV.
Yeah. Yes, exactly. This is definitely one of those TV myths maybe. And I think also just, maybe celebrities or well-known people, if they need a transplant, there's just more media attention surrounding them, right? I mean, if your neighbor got a kidney transplant, you're not going to have the news stories, that be reporting on it. But Selena Gomez got a kidney transplant because she has lupus. And a lot of people, have questions about that. And like, how did that come to be? And I think that is a worry that when people are thinking about organ donation for their loved ones or for themselves, that they think, well, it doesn't, it's just going to go to somebody who's at the top of the list because they have, a lot of money and they paid to get there. But that's simply not true. Our system we call it allocation, but finding the good matches, the good recipients, that is run by UNOS, and UNOS is federally regulated. We're all under, regulations from the government to make sure that we are performing as we should. And actually the people who are at the top of most of these lists are the sickest people. The people at the top of the liver list, it's usually within like a region, like 250 or 500 nautical miles from where the donor is located. And truly the people at the top of the liver list aren't going to make it another 2 days. That's how sick they are. So it's the sickest people within a region who are at the top of most transplant lists for every organs. And the people who are at the top of the kidney list tend to be the people who are going to match with almost nobody in the country. So they're very difficult because their antibody is very difficult to find a good match and a good kidney that's going to, suit them and, work for them. So that's why we put them at the top of the list. So we can try, if it's going to be a 1 in 1,000 chance, we want to make sure that we try our best to see if that could work for that recipient.
I'm guessing we could have an entire episode around UNOS myths.
We probably could, but we really don't want us talking about, they're very complex and the intricacies about that. And, currently the system for, organ donation and transplantation, how that works in this country is going to be revamped soon. So a lot of us don't know what it's going to look like in the future. I do know that it's going to get better. I feel very confident about that. But right now we're going to be in a transition period coming up very soon. And I think we'll just have to wait and see what that looks like.
Okay, number 11, I don't need to tell my family I want to donate. It's on my license.
Yeah, this is something I don't know why people want to keep it a secret. If they truly want to be an organ donor, you can sign up in a lot of different ways. A lot of people are caught, with that question when they go to get their driver's license. That is one way you can sign yourself up on the registry. But I think this is kind of part of what you're getting at too with this series is choices surrounding your death. Make them known to your decision makers. This should not be something that is sprung on them, when they're reading through your paperwork after you've passed away. Like this is, hopefully people need to be talking about this more with their decision makers and getting them documented in a legal way. If you have wishes that you want followed after you pass away, like make sure that those are known and documented. Most power of attorney for healthcare paperwork includes a section about donation. That's another way people can sign up to be an organ donor. So I think it's important to have that conversation and not just have that little dot on your license. Well, that is important. It's not the only way.
Yeah, a couple of questions around that from my perspective. I have also heard a myth that dot doesn't mean anything.
That dot gets put there on the driver's license when they're made if you sign up to be on the donor registry. They are linked. So, yep.
So it is real. Is that enough?
It is real, but it's not always the most current. If somebody goes back and removes themselves from the donor registry, they would still potentially have that ID card with a dot on it. So one of the things that we do in our role is to check on the donor registry. We don't look at driver's license. I don't think anybody in the hospital even looks at driver's license.
Yeah. You always check the registry.
We check the registry, and then anyone that comes in from a different state, we have the ability to check the registry in any state Actually, anywhere in the world, we've called to various countries, even if someone is here visiting, to see what their registry status is. But we also look at power of attorney for healthcare paperwork. That's another thing that we would, obtain from family or from medical records to see if they've made any decisions about donation.
I talk about, values and things, and, we have different values when we were 20 that we do when we're 40, and another set of values at 60, right? Like somebody can literally put themselves on the registry, take them off the registry, and then like put themselves back on the registry in theory, and like either have the dot or don't have the dot. I mean, I understand that that's like, it's good for the first time, but it can change. And so that means also you can change your decision and you can go out and make this decision for, I mean, it's kind of like changing the batteries in your fire alarms. Like every year you should think about your death wishes and be like, organ donation included, right? Like, do you want this? Because it might be different when you're 30 than you are when you're 80. I mean, these things are different. I'm also very curious and hopeful that I can help somehow get people either on the registry, off the registry, whatever decision they make. Is the goal to, 100% of people would at least visit the donation registry and make a decision one way or the other? I mean, is that the big, hairy, audacious goal for the, organ and tissue donation centers?
I think it's that, but also telling your families, right? Because it should never, when we're first sitting down and talking with the family about organ donation, it should really never be a surprise to your family if you want to be an organ donor, right? Okay. And that happens a lot where people will be like, wow, we never really talked about it. So it's important if you want to donate or don't want to donate. And there's many ways that people can document their donation decision. We've already alluded to going to the DMV when you get your license or renew your license. That's one way. We've talked about power of attorneys for healthcare. Another way that you can do it in the state of Wisconsin is when you get your hunting or fishing license, you can also indicate your desire to be an organ donor that way. And they actually just passed a law this year where on your taxes, since everyone has to submit taxes, if you want to donate, there's a section there where you can indicate your desire to be an organ donor as well. You can also just go ahead and sign up on the registry yourself. And we can provide you with a link that we utilize with our organization. That'll take you right to the Wisconsin registry. And on that registry, it'll say, put me on the list or remove me from the list. So you can make it, kind of clear your decisions. But the hard thing is that sometimes maybe somebody signs up when they fill out their taxes, right? But they didn't at the DMV 7 years ago. So there, you might have an instance where somebody has a driver's license that doesn't have a donor dot, but we can show that this year that they indicated they want to be an organ donor.
Which brings me to my next question is I talk to my family and they're like, yeah. And then we get to the place and the family's like, I know they wanted it. I don't want it. Tell me what happens then.
The people that we have that meet with families on their worst days, that's a job that I could never have, but we have very highly trained people who meet with families on their worst days to talk about organ donation. And it's just having a conversation, right? Tell me more about that. This is your loved one's final wish. They have indicated their decision to be an organ donor, but tell me about how this is making you feel. What's uncomfortable? Are you uncomfortable because, we just told you that they might have to be in the hospital for another 2 days? Is there something that we can do to help you? Are you uncomfortable because we need more people to come here? Are we waiting for family to come out of state? Are you worried that we're going to have to go to the OR too soon?
Yeah. Because, are we dispelling one of these myths?
Yes, exactly. Yeah. And finding out more about that. And like Louise said, when we have these conversations, we want our families to be in a place where they can make decisions. And a lot of times these conversations sometimes unfortunately have to happen so quickly, and our families are having reactive. They're reacting to the conversation as opposed to, sitting down and making an informed decision. Mm-hmm. So really, whenever we hear that, like, wow, I know they're on the registry, but I just can't do it. We just have a conversation about that more and explore it more. Like you said, a lot of it's myths.
Yeah. And which is also an argument for having more than one person know, right? Like I have a sister and brother. They both know that I want to donate my organs. If my mom says no, my sister and brother are stepping in and saying, yeah, this is what she wanted. Stop.
Yes, it's really, we do our best to advocate for the patient, too, because that family, again, they're going through unspeakable tragedy. And sometimes it's really hard to see the next minute the next hour that happens. And we really try our best to advocate for that patient that's in that bed. And if they were sitting right here next to you, what would they tell you that they wanted? And a lot of times we already know what they wanted because they have documented that decision.
One thing we see is a lot of times families feel a huge sense of relief when they know that that decision was already made by the patient and they don't have to make that decision anymore. They just have to be there to support that process. And I think a lot of times families are just like, I'm really glad that they made this decision one way or another, so I didn't have to. And they know about the decision ahead of time.
Do you ask every patient, or if it's a no on the registry, you don't even ask?
If they're a no on the registry, we just ask to make sure that that's the most recent document. Like, for example, if it's like a power of attorney for healthcare, sometimes families will have a hidden one somewhere in a drawer or a closet. You know, they got to find it, or their cousin has it in some other state, something like that. We just want to make sure that there was no, changes to their wishes is what we would just like to verify with those people.
With every patient that's about to die or that's on life support, or like, do they all get asked?
No.
Okay.
That's the simple answer. If we've ruled them out for donation, if the situation isn't appropriate for that patient clinically, or if they're not intubated, we don't get those patients. You have to be with a heartbeat on a ventilator is kind of the minimum requirement for organ donation.
And then you go down your protocols. Yeah. Okay.
Yeah.
Okay. That's good. I mean, I don't know if that's good to know for everybody. It calms my mind. I don't know why.
Yeah, we don't want to talk to families about things that don't pertain to them in those moments.
Well, if it's not going to happen, it doesn't matter, right? Like, we don't want to put this on people that it's not going to make a difference for, right?
Exactly.
I have so many more questions, but I can't. I'll have you guys here until like 10 o'clock. I just really want to tell all three of you what a gift you are giving by working a job. And I'll say it again, like, there are callings out there that you just happen to get paid for. And I think, again, one of the things that like hurts my heart about this is I really just don't feel like there's enough support for you and your other team members. Like, I know you have peer support, and I know that, there probably is things here and there, but like not enough for really like caring for the people that are caring for other people on their worst days of their lives, which you have to do over and over again. Some people only have one worst day of their life, and you are being privy to that over and over again, which can be extremely overwhelming. And, I'm sure you guys get desensitized to it, right? Like, there are still ways that you feel and emote and get overwhelmed and that kind of thing. But again, you have kids' spring concerts that you have to get to, and soccer games, and like all of the other things that us normal people, like normal, like workers have to do, right? Like, you're still doing this for a paycheck. And I'm guessing that paycheck isn't high enough either. So is there anything that anyone listening, is there anything I can do, we can do to support you as your team? And I know that's a big question. You don't have to necessarily answer me right this second, unless you have like super great ideas, which I would definitely take. But I mean, nurses in general, right? Like, they all need support. But I think in this particular situation, like, you're dealing with death, you are dealing with tragedy and accidents and trauma, and even on a 98-year-old dude that is donating his liver, it's still a gift. It's very high, very low. Is there anything that you can think of that would support your team members?
I always think about like an ounce of preparation or prevention is worth a pound of cure, right? So like, I think about the things that I can control in my life. I think about what I would ask others to control in their life. Wear your helmets, wear your seatbelts, do your power of attorney paperwork, talk to your family about what you want should something unthinkable happen. Like, really think about the situations that you're putting yourself into, and think about how your family would deal with that without you there to help them. And just kind of like take those opportunities to, be really thoughtful for your family, for yourself, the people who are going to have to care for you, and do your best to prepare in the best way that you can. I think that's probably the biggest ask, I would say. And then just like day-to-day things, like, if you're in the hospital, we obviously want you to understand what you're going through, and we want you to be the expert on your own illness, your own care. There's ways to do that are very helpful with good questions. There's ways to do that are not so helpful. And, I think everybody just wants to be treated with respect. And so, you're absolutely going to be treated with respect, or you should be in every healthcare situation. We would just ask the same in return.
Yeah. One of the things you said there was just really to make your jobs easier, it would be the directive. Yes. Everybody's nodding their head.
Yes,
Like,
absolutely.
Yes. Unmute. Everybody's saying yes. Just if there was an ask right now, it would be, please tell 2 people that you either want to or you do not want to be an organ donor and go to the registry.
And fill out your power of attorney for healthcare paperwork. Absolutely. Because the power of attorney for healthcare is the only way that you can legally document your decision to not be an organ donor. On the registry, you can indicate your desire to be an organ donor. You're either registered or not registered. And just because somebody's not registered does not mean no to organ donation. That just means that the decision is going to be going to your next of kin, to your people, to your loved ones. Whereas if you have documented your decision to be yes, that decision has already been made by you and it's not to be made by your family. But if you truly do not want to be an organ donor, we really want to respect that at your end of life. And so the way that you can do that is by filling out your power of attorney for healthcare. And you can do that without going to a lawyer. It's free of charge. If you have the right people in the right place, you can fill out that paperwork and make sure that your wishes are known.
Where can you do that?
So I usually start out, if you go to your doctor's office, your PCP, there's usually going to be a social worker within that office that can give you the paperwork. And there also is usually an informational sheet on how to do it, how to fill it out. And really what you just need, the biggest thing that you need when you fill out that paperwork is you need to have 2 witnesses that are not related to you or are not going to be your power of attorney for healthcare. So you can have your neighbor on each side be your witness for that paperwork when you fill it out.
And that's something you can fill out at home. You don't need it notarized.
Correct. You do not need it notarized. It just needs to be filled out at home. And then the other thing is when you have it filled out at home, don't just stick it under the bed sheets, right? Like you have to bring it with, you can fax it to your doctor's office. So they can upload it into your medical chart. So, that can be accessed that way. Make copies of it and make sure that the people who are your agents, that they have a copy of that paperwork too on hand. That's the easiest way to document your decisions. And it's not just about organ donation too. I mean, it has to do with anything at end of life, right? Like if your family removes, a feeding tube from you, if you have no hope of surviving, really important things that where if, let's say you're hospitalized and your body's in a condition that you're going to require extra care, you need somebody to direct that extra care. And if you do not have a power of attorney for healthcare, your loved ones are going to have to go to court and file for legal guardianship. And that costs money, whereas it costs nothing for you to fill out this paperwork.
If I went to my doctor, it's not like doctor specific, right? Like it's just a PDF out there somewhere. Like I could attach it to this podcast show notes and everybody could print it out and do that.
Yeah. There's a couple different forms in the state of Wisconsin that are widely available through Wisconsin Medical College, and what's the other one? There's the Wisconsin State form. There's 2 very standard forms that are out there. Yeah, you can just Google Wisconsin POA and you'll find
anything else you guys want to add before we wrap up. I cannot express my gratitude enough for you guys coming on to do this. Obviously it's important to you, right? Like you're not getting paid for this. You're not getting anything extra for this, right? Like you're just trying to make everybody's lives better that you deal with on a regular basis. And one of the things that I've heard a number of times is please tell somebody and write it down as a power of attorney, right? Like those are 2 very simple things. We push those things off because it's real fucking scary, right? Like I don't want to die in a car accident and all of my organs get, I don't want to be in a position that does that, except we don't know. And also, I'm guessing I'm going to say this right, that you're never too young to do this.
That's correct. I think 18, you have to be an adult, right? To make legal decisions. I think if we're talking about being too young, even our, donors who are under the age of 18, but maybe are on the Wisconsin registry, while they have indicated that that's what they want to happen, their parents in those situations still have the ability to reverse that decision to say, no, Where if you are over the age of 18 and you have documented your decision to be an organ donor, that's legally binding. Like that is going to happen. If you can donate, it's going to happen. But otherwise, really, I think age 18 is when most legal things kick in. The only other
so
thing.
If you're 18, you can make this decision on your own, right? Like,
yeah,
you can do this and you should do this. You should tell your parents. You should tell your girlfriend or boyfriend or whatever. Although we probably all know that those guys aren't sticking around at 18. Most of them anyway.
Mostly not.
Mostly not. So maybe pick a sibling. Again,
Right.
Anything I know I've said, please say anything. And then I said something. You guys go ahead if you have anything else to add.
the last thing, I mean, we actually all came up with like things that like, what's like one takeaway we want people to have if they're listening to this? And we've already touched on a lot of them. I think the last thing that we really want to talk about is hope and how much hope that you can give to somebody. You know, like Louise alluded to, most of the people that pass away in this country are never going to be considered for organ donation. You know, people tell me like, oh, I'm an organ donor. And I think in my head, I hope you never are, actually. I hope that you're never in a position where we're going to have those discussions about organ donation. And even those people where they are passing away in a manner where we can consider them for organ donation, it doesn't happen all the time, right? Sometimes we think that somebody's kidneys are going to be healthy enough for transplant, and we do our workup and it turns out that they aren't. But the fact that somebody said yes gives so much hope to those people who are waiting. Like we talked about, there are people who are dying every single day waiting for this life-saving transplant. And the fact that there's people that say yes out there and that want to try to donate and want to try to help save people, that provides so much hope to those recipients who are waiting.
Yeah. Again, I want to thank you guys for coming on. We're going to make sure to put as much information as we can in the show notes. I will mention the Death Cafe again. We are having on November 10th from 1 to 3 in Cross Plains, Wisconsin. So if you're a local and you're listening to this in the Madison area, or if you'd like to travel to come and see us, we're going to talk about death from 1 to 3. You guys will be there. And also the gals from Good Morning, who are event planners for Celebrations of Life and Living Wakes, we've talked about, which is fascinating to me as well. Really, part of this series and part of really the whole podcast is meant to be these subjects that are extremely hard to talk about for some people. Sometimes there's shame around them. Sometimes there's anxiety or fear or just myths around certain things that if we can just talk about it and we can be very respectful of each other and we can understand that, you know, no matter, especially death, like none of us are getting out alive. Everybody is going to die. We don't get to choose necessarily how we do that. And if you are prepared, it can just it's such a gift to the family around you. And I've said this a number of times, probably in this podcast and in other places. My father-in-law had no idea he was going to die, right? Like he went in for a quote unquote routine open heart surgery, right? Like he had a valve replacement, an aneurysm, and that was his heart valve. And it was just a total fluke that he passed away, right? Like nobody knew that, nobody planned it, but he had everything in place for his family. All the passwords, all the account numbers, the plot, I want this at my funeral. He had everything done. And it was I have goosebumps. It was such a gift to my mother-in-law and to the family because in 3 weeks they were done, right? Like they got enough death certificates and everything was just done and they just didn't have to do anything anymore. It was a really rough 3 weeks, no doubt. But some of these things, when you're not prepared, go on for years. So there's like never any closure. It's just always, it becomes a really big chore for somebody while they're grieving. And so it was such a gift. And so the more we talk about this and the more we prepare, whether we want to have it happen or not, it's going to happen. And just talking about it, just having you guys on here, just to say, yes, we are present for people's worst days, but also possibly their best days, like somebody else's best day. They've been waiting for a transplant, likely. You also get to be a part of that gift and the hero and the journey that recipient is on. What a gift to talk about. And to be very honest, I just haven't really ever heard of it, right? Like you hear these myths, But when do you get a chance to talk about it? When do you hear about it? You guys probably are in a small part of the big healthcare system. It's such a small part. So when do you get to really share this with somebody and realize that you can make a difference for the living and make your jobs easier? So to all the listeners out there, if any of this resonates at all, please go to the registry, fill out your power of attorney, come to our death cafe, and send these women some baked goods and massages.
I mean, I was thinking the other day when we were talking about and preparing for this, it's like, there's only about 400-ish, give or take, organ procurement coordinators in the US, and 3 of them happen to live in Cross Plains. Like, what are the odds, really, right? Sort of like, when lightning strikes, maybe it strikes 3 times, but I think it's just such a beautiful kind of similarity with the rarity of organ donation, of how rare our jobs are and how really, in the grand scheme of things, it is a blessing that nobody knows what we do.
Yes, absolutely.
We also have such a responsibility to share it with everybody who's willing to listen, because in the rare event that you do have to deal with these things, there's a lot that goes into it that impacts the way that a grief trajectory starts and continues over time. Yeah. And, we have literal lives in our hands, not just the donor or their recipients, but we have the lives and the minds and the hearts of the donor families too. And what we say and how we handle them in those very tender moments can change everything for them.
The recipient part of this too. Yes, you can talk about the importance of the donation, but also you might be the one that needs one. You also don't know that. You might be the receiver and someone that needs it. And I feel like what goes around comes around. I know I said that and you guys are not, but I know that we said that we weren't going to say, we're going to talk you into this, but just remember that you might need one someday. That's all. So thank you, ladies. I really, really appreciate you reaching out to me. I really appreciate you being on and taking the time and the energy to go through this. So thank you so much. I appreciate your willingness and candidness. Oh, one of the things is, if someone has questions, is there ways to reach out to you guys? Do you guys have social workers that somebody would call up and be like, hey, I heard this. I have some more questions. I've heard this myth or whatever. Is there somebody to contact?
Yeah, one of the websites where you can document your donation decision, it also has more information about organ donation. And that website is heroicdeed.com. There's information there about organ donation. And I think there also has some information about the specific organization that we work for, and probably some contact information if somebody had any further questions. Okay. Otherwise, come to the Death Cafe.
Come to the Death Cafe. It's going to be fun. I'm going to have coffee and treats and maybe some ice cream. So, okay. Thanks, you guys. I really appreciate it.
And that's a wrap on today's episode. I hope you enjoyed diving deep into the world of living authentically with me. Before you go, don't forget to connect with me on Instagram. Shoot me a message at Katy Ripp. I'd love to hear your thoughts on today's episode and connect with you further. And remember, if you want more details on today's episode, or just want to explore more about designing your life unapologetically, head on over to my website at katyripp.com. There, you'll find all the juicy details and resources you need to keep the inspiration flowing. Lastly, if you'd like to join me on the show, whether it's to tell about your experience of designing your own life, to share your expertise, or if you'd like to participate in lifestyle coaching live on air, don't hesitate to reach out. Your story could inspire countless others on their own path to living authentically. Thanks for tuning in. Until next time, keep living boldly, designing your life, and remember, #actually, I can.